As a primary care guy, I had no idea the barriers that were set up to provide good, so-called good mental health care, confidentiality requirements. I mean, it's eye-opening when you see the barriers that are placed by state, governmental bodies on how you can deliver behavioral slash mental slash chemical substance issues. It's just astounding.
I'm Claire Scott, and I'm the manager of the Integrated Services Program at the Mental Health Center serving Boulder and Broomfield County. And my job is to collaborate with Clinica Family Health Services, Salute Family Health Services, and Work First Boulder County, and put behavioral health services into those practices.
And I'm Chris Keenan. I'm a family doc at Clinic Family Health Services at their smallest site, a 2-pod family medicine model clinic in Lafayette, Colorado, and we obviously work with the Mental Health Center.
Because of this commitment to serving less acute folks, and also the realization that services at the Mental Health Center are relatively expensive, and we tend to overserve because we have a model where if somebody comes into our system, we do a huge assessment and intake, all paperwork required by the state, and then we do a discharge. So it's a lot of work to come in and come out. So it's easier in some ways to keep people enrolled in our system. And we don't have the capacity to do episodic care, and we wanted to move into a model that offered that. And the community clinics mission and service provision system is such that you walk in, you want medical care, you get it, and you're a patient there for as long as you live in that community. And so there's none of this kind of formal in and formal out. And so that matched with how we wanted to be able to provide behavioral health care. So it was really our agency leaders that got together. They had heard about integrated care at a couple of different in-services. I think Pete Liebig, the CEO of Clinica, heard about it at a presentation in DC, and Barbara heard about it at a presentation through the Colorado Behavioral Health Care Council. And there was sort of a synergy about the two of them coming together and saying, let's do this. I got hired to go ahead and get the project rolling. And I had the benefit of being fairly familiar with the Clinica system because I had been an employee there before, and sort of knew those folks, and then I had been at the Mental Health Center as a team leader for a while. So I was fortunate enough to get the position, and we spent about 3 or 4 months problem solving about how to develop the program, and then the following July or September, we hired our first behavioral health professional, BHP, and was Jennifer Peck. And when she came to the clinic, then we asked Clinica's social worker, who was already there, to change her practice model to fit a behavioral health consultation model. And she changed her practice from what was looking more like a more traditional outpatient therapy model where you signed up for 50-minute appointments and you saw the person, and moved into doing more on-site consultations and fairly brief interventions. And that's really when we started using this particular model. So in terms of the change, we were asking the behavioral health person on site at Clinica to change her model. We were introducing a new person, and then we were beginning to ask all the providers to think about using behavioral health services differently on site as well.
For them
I think we asked them to adopt a clinical model of using SFBT, which is a model where we really make the assumption that patients do know what's best for them. And we do believe that the problems that they're very confounded with have an exception. There was a point in their time, however brief, in their life where what they're talking to us about wasn't a problem. And so part of our work is really staying in a very non-judgmental place about what would be useful for that patient and working hard to elicit that. And it also was a model that asked for very small incremental change. We're not asking for people to resolve complicated issues of trauma and substance addiction or anything. We're asking for one small change. And with our belief that one small change empowers that person to consider making bigger changes, and we're pretty.
Yeah, and how do you treat the resource with respect when familiarity breeds contempt? I mean, it's not at that level, but I'm just saying this is a specialty resource. I think because the psychiatrist is readily available, sometimes you forget this is a specialist and deserves to be treated as you would treat any specialist that you appreciate and don't want to lose access to. So it's just not taking people for granted, I guess.
I think there's a case study in the final report around managing somebody who, or responding to somebody who was calling the clinic call appointment number, and the call center person hearing that they were suicidal, and how that call got transferred to the nurse manager with backup from the BHP, and then I think there's a consultation with the mental health center psychiatric team, and anyway, this really nice envelope that was put together for this patient to respond to their serious suicidality, and it had a really good outcome, but it was all done on the phone, and it all was people calling the right person and them all being available and being supportive and useful and helpful at the same time. I think that I don't know that this patient could have called the community health care clinic for an appointment feeling suicidal and having their need met in such an efficient, effective way.
So it wasn't a go to the ER, it was a we can address this problem.
We can handle this, and I, as the call center, and as the nurse, and as the BHP, and as the mental health center emergency psychiatric team, I can handle this because I've got somebody behind me who can support me, and I'm part of a larger system, and I'm part of a team that can hold this. And I think everybody had a very positive response to it.
I was just thinking, two stressed out teams of care providers working together is always superior to two isolated ones.
Yeah, right.
Even though we try and be proactive, comprehensive, providers of preventive, chronic, and acute care, the chaos of the lives of some of our patients affects our clinicians. So even though our organization has been committed, as long as I've worked there, which is almost 15 years, to continuous quality improvement, it's hard to change. It's hard to keep the process ever churning, these plan, do, study, act cycles. You can get change fatigue, and you start, individuals will start opting out of things, not vocally or explicitly, but implicitly they tune out. I think we're coming to appreciate what the other can provide, and that's just you got to spend time together. It's like being married. I think that was a good metaphor.
Yeah.
You just have to spend some time together and see what the other person can do for you, and how they can make your life better, without taking them for granted.
There was a position created to spearhead the program and to champion it in both systems. So I spend my day basically driving from clinic to the mental health center, attending meetings and cheering people on and supporting things and keeping things going. I think it's very difficult to plop a behavioral health person onto a medical team and say make integration works, because there's so much vertical and horizontal integration that needs to occur to support these positions, that you really need somebody that can have just a little bit of caring distance from the actual work, and can be able to negotiate at all levels of each organization to support it.
Yeah, I totally agree, Claire. I mean, without her, I was just thinking when we were flying out, I was like, I didn't do anything to prepare for this meeting. Thank God Claire, has done the math and put together the presentation and moves across sites and identifies issues and gets, it cheerleads it, champions it. And I think that's a very important lesson. Leadership from the top, Pete and Barb, commitment of resources to hiring a champion, and then, ongoing infusions of love to keep the ball rolling.
Right.